Topic is Hesselbach'S triangle. Hesselbach'S triangle. It is triangular area present on the anterior inferior wall of abdomen. Anterior inferior wall of abdomen. Medially, it is bounded by lateral border of rectus abdominis muscle. So this is Hesselbach's triangle, and medially it is bounded by lateral border of rectus abdominis muscle. This is the lateral border of rectus abdominis muscle, and laterally it is bounded by inferior epigastric artery. As seen in the diagram, laterally it is bounded by inferior epigastric artery. Okay, base is formed by inguinal ligament. Inguinal ligament. Base is formed by inguinal ligament. This is the inguinal ligament. Base is formed by inguinal ligament. And the floor is formed by posterior wall of inguinal canal. Okay, floor is formed by posterior wall of inguinal canal. Now, how is this Hesselbach's triangle distributed? How is this Hesselbach's triangle distributed? Inguinal hernia is divided into two types depending upon this Hesselbach's triangle. Depending upon Hesselbach's triangle. So, if hernia is passing outside the Hesselbach's triangle, it is called indirect inguinal hernia. If hernia is passing outside the Hesselbach's triangle, it is called indirect inguinal hernia. Okay. If hernia is passing through the Hesselbach's triangle, if hernia is passing through the Hesselbach's triangle, it is called direct inguinal hernia. Okay, direct inguinal hernia. So, the direct inguinal hernia is further divided into two types: lateral direct and medial direct inguinal hernia. So, lateral direct inguinal hernia is lateral to the umbilical artery. Simply lateral to the umbilical artery. And medial direct inguinal hernia is medial to the umbilical artery, obliterated umbilical artery. Okay. So what is the characteristics of Hesselbach's triangle? It occur in old age. It occur in old age. It is acquired and it is usually bilateral. Okay. It occur in old age. So what is the applied anatomy here? In long standing hernia, inferior epigastric artery help to differentiate between direct and indirect inguinal hernia. Indirect hernia protrudes through the inguinal canal, and the direct hernia protrude through the back of the wall of abdomen. Okay.